I just want my pain to end.
Dr. Susan Moore battled COVID-19 in December. She turned to Facebook to document her fight for fair medical treatment.
You have to show proof that you have something wrong with you in order for you to get the medicine. I put forward and I maintain, if I was white, I wouldn't have to go through that. I was crushed. He made me feel like I was a drug addict, and he knew I was a physician.
Days after she was initially discharged, Dr. Moore died from coronavirus complications. She was just 52 years old. And while the Indiana University Health Hospital System denies mistreatment in her case, Dr. Moore's story has resonated with African Americans across the country.
She was a doctor and they still didn't want to give her the proper treatment.
COVID killed Black people in this country at 2 times the rate of white people.
The pandemic exposed America's long history of inequitable medical treatment for Black patients and its legacy of broken trust.
Hey, Dr. Davis, hi.
Dr. Samson Davis runs a COVID-19 testing site in Harlem. In his 20 years of providing health care in African American communities, he's witnessed patient after patient reluctant to seek the medical help they need or enroll in clinical trials, worried their care will be impacted by the color of their skin.
Our grandparents, our great-grandparents have passed along the mistrust of the healthcare system.
And as the nation rolls out the coronavirus vaccine, a study conducted by the NAACP and COVID Collaborative found just 14% of African Americans trust a vaccine will be safe, and only 18% trust it will be effective.
I see the hesitation with African Americans and Latino Americans taking the vaccination just because of historical factors.
Some of my family members say they want to take it. Some say, no, I'm not going to take it.
A decision especially difficult for Ron Lacks, the grandson of Henrietta Lacks.
In 1951, she went to Johns Hopkins Hospital for cervical cancer.
Henrietta Lacks, known as the mother of modern medicine, was portrayed by Oprah Winfrey in The Immortal Life of Henrietta Lacks.
She didn't donate nothing. They took them and didn't ask.
Without her knowledge or consent, doctors collected a sample of Henrietta's cancer cells for experiments. The cells were replicated in a lab and used to develop breakthrough treatments and cures from polio to AIDS, leukemia, and even coronavirus. Her cells have been replicated and sold all over the world, benefiting countless pharmaceutical companies.
The family tried to find out more about it, and doors was really shut in our faces.
And medical experiments on African Americans started long before Henrietta Lacks. There were the men of Tuskegee, Alabama. The year was 1932. The U.S. Public Health Service told 600 African American men, mostly rural farmers, they would be treated for bad blood. But that was a lie.
There were 600 African-American men, 399 of whom had syphilis, and they were unknowingly included as subjects in this longitudinal research study.
28 men in the study died from syphilis. 100 more passed away from related complications. The federal government continued the Tuskegee experiment for 40 years. Dr. Peter Millett is Executive Vice President of Meharry, one of the nation's oldest and most prestigious historically Black medical schools.
If you want to look at how this came about, you've got to look at the history of African Americans in this country. You've got to go all the way back to slavery.
In 1851, Samuel A. Cartwright defined drapetomania as a form of mental illness that causes slaves to run away. And shortly after slavery was abolished, Dr. J. Marion Sims practiced surgeries on Black women without anesthesia to prove they had a higher threshold for pain.
That history cannot be ignored or dismissed.
National Urban League President Mark Marial is now co-chair of a new vaccine equity task force commissioned by Governor Andrew Cuomo to ensure racial disparities in coronavirus testing and treatment do not persist with vaccine distribution.
I understand the cynicism and the skepticism. It is not without cause. The Tuskegee experiment is a terrible stain on the soul of this nation.
This has to be a wake-up call for an inequitable public health system.
Public health experts from New York State to Meharry Medical School believe the first step in bridging the vaccine trust gap is bringing distribution directly to diverse communities.
It's got to be available at community based locations, schools, community centers, nonprofit facilities. Healthcare is a right. It is a God-given right.
Ayana Harry, Pix 11 News.